Guys, so today we're going to talk about flange sizing and your Eufy S1, S1 Pro, and your Eufy E10. So these are standard suction pumps, which means that they are a pull and release pump. The nipple is going to be pulled forward and then suction is going to go back to zero in between each pull. So it's going to pull and release. That means that we need to keep the areola out of the tunnel. We want only the nipple in the tunnel, but we want enough space around the nipple that it can move freely. That does not mean that the nipple cannot touch the sides of the flange, but what we want is unrestricted movement across the entirety of the flange tunnel. So where this gets a little tricky is you can't necessarily see through here. That's a problem that we have with all wearables. So with wearables, what we do is we start by measuring your nipple. I'm going to link down below our resources on flange sizing, and that is something that if you are struggling, about 40% of moms consistently struggle even with really good directions because they struggle to measure their nipple. Now, where I'm seeing this get increasingly complicated is that there was a new flange study. It looked at about 30, 35 people, and it said that you could measure just the tip of the nipple and get a flange size that you could use. That doesn't work with wearables because the second part of that study said that's our starting point, and then we need to heavily visualize using a whole series of sizes around that size. The strategy that we use for sizing wearables that we've been using for thousands of moms for several years with really good success actually involves measuring the base of the nipple, which is going to be an easier landmark for the average mom to identify. About 60% of moms will be able to identify with these instructions. And then once we account for their type of anatomy and their elasticity, it'll be smooth sailing from there. The other 40%, they may need professional help. That's completely fine. If you are struggling with flange sizing, you don't even necessarily have to wait until you can see a lactation consultant live. We can do that virtually for you using video chats. We can also size you non-live using photos and videos, which is actually the most evidence-based method that I have to offer you because it allows us to see in greater detail. But I will link all those resources down below. With the Eufy, what I'm consistently seeing work is that same suction that we're seeing and that same sizing we're seeing work with other standard suction pumps, which is somewhere between 0 to 4 millimeters. Most moms are going to be about 2 millimeters bigger than their base nipple size measured pre-pump, measured at the base of the nipple and areola. If you have more elastic tissue, you may be closer to exact sizing. I have not actually had anyone need smaller than exact sizing with a wearable. It's never happened. And the reason we don't recommend that is that one, the only people I've ever seen that need sizing smaller than their nipple size tend to be moms with Ehlers-Danlos, connective tissue disorders, extreme elasticity. It can be secondary to extreme weight loss and weight gain over time, causing the skin to behave differently. Those moms actually don't do well with wearables, period. It's not a good fit if you have that type of extreme elasticity. Because what happens with these smaller motor pumps is that if the tissue is not able to move, it gets stuck. It acts like a cork that's going to put excess strain on your motor. Your motor is going to quickly start to overheat and burn out. So you can actually we refer to it as corking. You can cork your pump and you can actually cause motor failure. Guess what? That's not going to necessarily be covered by a warranty. And I think as we see an increase in this in the pump industry, companies are going to get smarter about this. Manufacturers' warranties are intended for defects in the motor. They're not intended for user-induced failure. So that is definitely something you want to watch because I think pump companies are going to catch on to this as we see the end results of, changes in flange sizing. So start with the resources we know that are working. Measure the base of your nipple at least 2 hours before pumping or 1 hour after last nursing. Follow those directions. If you're still struggling, reach out. But what we want to do is we want to use inserts. The average mom is actually going to be smaller than a 24. That does not mean that everybody is smaller than a 24. There are people out there who do need 24 and 27 millimeter flanges. 27 millimeter flanges also allow us to provide space. So one of the hacks we use is with a legendary insert. We'll take a legendary insert, which is between a 15 to 21 millimeter insert. It's meant to go in a 24, but we can actually get a little bit more space when we use it with a 27. That wide rim allows it to get a good air seal, but what it allows it to do is to remove some of the pressure on elastic nipples. Where this is really relevant is that this pump in particular, the S1, has a lot more flex to it. You can actually take a small insert, pop it in here. It's not so much movement that I can catch it on camera with it being like a usable video. But if you take this and you plug it with your thumb, turn on your pump, and turn it up, you can actually see that in this area right here, this pump is actually collapsing in and out, which means you want to leave enough space that the nipple is not getting overly compressed. And if we're using inserts that are too small and then we're taking and we're compressing that tissue, I mean, it doesn't take a rocket scientist to see that you probably don't want to make a nipple sandwich out of yourself. When moms get their nipples overly compressed by nursing with a tongue-tied baby, we know that it hurts. When the latch is shallow and the nipple's compressed, it hurts. The same thing happens with pumping. Don't fall for that. This is not coming from pumping experts. So that flex means that we sometimes have a little bit of different flange needs. Now the E10 does have a little bit more flex than the average body shape like this. I think these are just higher quality motors. Some of the other motors are underpowered, and even if they're producing the same suction, they're not producing the same hold. And it's that hold that allows a flange to flex because it's silicone, it's moving with the suction pattern. In terms of inserts, we have inserts from 11 millimeters up to 27 for this. So with the 27, you've got options, you've got the 24, and then most of our inserts are going to be 22 millimeters down to 11 millimeters. Eufy does come with a series of inserts. This is their original that had holes in it. We've had really mixed results with this one. I'll be honest, I don't typically recommend this because I'm a little concerned about having the holes in the side of it. So for the safety of my clients, I don't recommend using this. Some people are telling me they're using it with good success and they probably don't have super elastic tissue, which is also normal, but it's not my preference. Their newer ones do not have holes in it. So that is something to consider. If your inserts do not have holes, try the ones your pump came with. These are the Nursey Luna inserts. These are a soft pink kind of silky silicone that's being sold on Amazon in kits. I'm loving these for the Eufy. They seem to blend in really well, and that extra flex in the insert is allowing it to move with the flange. We do see good results with the Maymom shorts, which again, it has a very soft rim. This one comes in a wide variety of sizes, including some even sizes, so this is a really popular one. Willow inserts have been proving really to be strong performers. I find that this is working for my moms who need less flex in their flange because that fin-like design on it kind of wedges itself, and then the fins are moving versus the actual flange itself where your nipple is moving as much. It does decrease the movement in the flange. It also has a nice soft rim so that nothing gets caught out and bent up. We have had some moms that want less flex in the flange, and what we do is we use a Pumping Pretty. So let me pull this one out. This one is by Lactation Hub, and then it's just a thin, clear silicone that comes in the smaller sizing. But Pumping Pretty is what we use for moms who need a more shallow flange. So maybe they have a more broad kind of basketball-shaped breast where that deeper insert is a little bit much. We want to bring that opening forward, and Pumping Pretty has been one of the good options for that. This is not recommended for elastic nipples because it does have a U shape. This was originally designed for the OG LV pump, which means that U shape allowed suction with the LV pump, but it also means it's a really short insert for the average nipple. So definitely not something that I recommend if we think we have elastic nipples. But if we have wide, broad breasts, kind of shorter shank nipples, and less elasticity, that can be a really good fit. The other one is Legendary. Legendary is actually my favorite with this pump. This is hands down one of the best inserts for wearables, period. It gets a nice wide air seal. It's really comfortable. It has no texture change between your areola and your nipple because it's so wide and it's covering that skin, which means we reduce a lot of the sensitivity issues. If this fits in a wearable, this tends to be what I recommend if it comes in your size. It does only come in 15, 17, 19, and 21. So we do have moms that are below a 15 that need something different. We have moms who don't like this texture. We have lots of options. And all the inserts that fit with the S1 also fit with the E10. The shape of these is pretty much exactly the same. The big difference is the texture and that this has the heating element. So I will link all those flange resources down below. If you are having issues, please do not hesitate to reach out. It is not a bad thing or a shameful thing if you need help sizing your flanges. My dirty little secret is that if I size myself, I still do the same photos and videos I ask of my clients because sometimes what it helps is somebody who knows what they're doing being able to see it moving, and it's kind of hard to do it on your own body. So if you're having trouble, please don't hesitate to reach out. If you are looking for resources on that, check out the resources below, and hopefully this helps you, and happy pumping.